أعوذ بالله من الشيطان الرجيم. Bismillah ar-Rahman ar-Rahim. We begin in the name of Almighty Allah, the most beneficent, the most merciful. Assalamu alaikum, dear brothers and sisters in Islam. Welcome to our COVID-19 vaccination webinar, Making an Informed Decision. My name is Baqer Keshwani, and I'm an exec councillor for Nasimco. We have an amazing program for you today with esteemed and respected speakers who will enlighten us with their expertise. But before we begin, we'd like to thank our viewers for tuning into today's webinar. This webinar is intended to provide you with both medical and religious perspectives on COVID-19 vaccine. The information you hear today is not a substitute for any professional medical advice, diagnosis, or treatment. We strongly encourage you to consult your doctor or other medical professionals regarding the vaccine or any other medical questions you may have. Let me give you a brief introduction to our panelists. First of all, we have Dr. Mustafa Salehmohamed, who is a pulmonary and critical care physician in New York for the past 12 years. He works in critical care and has been part of the Nasimco Health Task Force for COVID-19. We also have Dr. Arif Dharsee, who's an infectious disease consultant for South Shore Infectious Disease based in Long Island, New York, with 8 years of experience in the field. Of course, we have Sayyid Rizvi. He is a scholar, author, resident Alim, and representative of His Eminence, Sayyid Sistani, and is based in Toronto. Last but not least, we have Dr. Akber Mithani, who is a scholar, speaker, and regional medical director, long-term care assisted living, Fraser Health Authority in British Columbia. He was also the head of COVID-19 task force for the World Federation and has been in geriatrics for more than 30 years. Welcome all. I'd like to start off with Dr. Mustafa, please. Dr. Mustafa, if you'd like to unmute yourself, please.
Thank you, Baqer. Assalamu alaikum. Just as an introduction of what's been going on, we've been living in unprecedented and very surreal times where we're going through uncharted territory, something that humankind hasn't dealt with since over a century in the last global pandemic of the Spanish flu of 1918. A city across the globe a little over a year ago starts with an outbreak, and it takes the entire world by storm. Just to give you an idea of where we are today in comparison to about a year ago, we have 85 million cases of COVID-19 in the world, and it's reaching the 2 million death mark as we speak today. In Canada, 600,000 positive cases with over 15,000 deaths. In the United States, 20 million positive cases, and we're almost reaching our 350,000 death mark as we speak today. This virus, this pandemic has and continues to devastate lives, families, and communities. It has and it continues to take millions of people's livelihood away. It has and it continues to cripple economies in North America and across the world. It has and it continues to overwhelm the healthcare system. It's overwhelmed us, it's frustrated us, it's caused us to feel this helplessness where we can't help our patients. I'll give you a personal account of what I've been through in the hospitals here in Queens when we went through its peak in April. A patient who comes into the ICU, if they get on a ventilator, the likelihood of that human being able to see their loved one again becomes a very, very low likelihood. This devastated Queens and New York, and we saw our darkest days in April and throughout the spring. And we're seeing those dark days again across North America as we have a record number of cases, as we have record number of deaths. And since that time, the world of medicine has gone through several therapeutic options. Some have worked, most have not worked. Even the ones that have worked have not worked for everyone. So the only thing that we felt that would allow us to come out of this devastation, allow us to come out of this catastrophic event would be a vaccine. Fast forward 10 months later, and now we do have a vaccine. and it's been made by 3 major pharmaceutical companies in collaboration with smaller companies, Pfizer and BioNTech, Moderna, and AstraZeneca in collaboration with the United Kingdom government. Now that we do have a vaccine, it's natural to have concerns. It's natural to have misgivings. It's the fear of the unknown, and it's a valid fear. It's a valid fear until that fear overtakes rational thoughts. Then it becomes dangerous to individuals, to their families, to the community at large. And that's why we have today's session. And that's in order to shed light on what is unknown to many. It'll allow you, the viewer, to be more informed at the end of the session, perhaps, than you were at the beginning of this session. We're well aware of all the information that's out there, especially on social media, on chat platforms such as WhatsApp, all the forwards that are going on of warning everybody and scaring everybody against the vaccines. This kind of fear mongering, this kind of misinformation and disinformation campaign is not new to the world of vaccines. As a historical point of reference, I want to harken back to when smallpox was a major pandemic across the world. The smallpox vaccine was created by an English doctor by the name of Dr. Edward Jenner in 1796. Even despite it being created at that time, it took a long, long time before we were able to eradicate smallpox. I'll give you an example. In 1885, there was an outbreak in Montreal. 2% of Montreal's population died from smallpox. So a vigorous vaccination campaign began. And just as vigorous as campaign of vaccination, there was the same fervor campaign against vaccination. Some of the tactics and reasoning that they used, and they may sound familiar to everybody. One of them was, this is the infringement upon our rights. The second one was they minimized the threat of the disease. They said the disease wasn't that as bad as everybody said as it was. Does that sound familiar to everybody or not? They claimed that both the vaccine caused illness and it wasn't working. Or they said it's either or both, that it was causing illnesses and it wasn't working. So it scared away a lot of people. And again, that sounds very common today. Number 4 was vaccines are part of a larger conspiracy. This is almost a little over 2 centuries later, and the thoughts remain the same. And the last one was they would use alternative authorities to legitimize their arguments. And yes, those authorities were others in the field of science or other physicians. And we see that today as well. Does all this sound very familiar to everybody? These are the same reasoning, these are the same arguments that are being used today. So our goal today is to provide you with the scientific evidence so that you can become more informed and make decisions based upon that. And equally, if not more important, to give you the religious, spiritual, and ethical aspect in relation to the COVID-19 vaccine. And with that, I'll segue back to you, Baqer.
Thank you for this, Dr. Mustafa. It was a very bleak start, but a very well lit towards the end of the tunnel. So thank you for that. That was really good. Dr. Arif, can we have you present what you have in store for us? You can unmute yourself, please. Thank you.
Assalamu alaikum, everyone. I just want to thank everyone for tuning in, as well as thanking nasimco for organizing this program. I feel like very important to know exactly, to dispel some of the myths that have been out there, as well as provide some basis for the vaccination. I'll try to make this presentation a little bit more free-flowing. So what we'll start out with is talking about the body's immune system and then why vaccinations are important. Then we'll segue a little bit into the 3 major vaccines that we've talked about so far, which is the Pfizer BioNTech, the AstraZeneca Oxford vaccine, as well as the Moderna vaccine. Then we'll shift gears and talk a little bit about the vaccination strategy, which is how we're vaccinating people and in what order people are vaccinating. And then I'll end with some common questions that people have about the vaccines and going forward. So briefly, when we talk about the body's immune system, there's different kinds of immunity that comes about. So one is natural immune defenses that we're born with. For example, our skin, there's little things that are like in our throat, different things that help the body from getting infections, versus something what we call an adaptive immunity, where the body learns to fight certain diseases. Now, the second part is where the adaptive immunity is where the vaccines come in. So the body can learn either by being exposed to a previous disease already. For example, if somebody has chickenpox already, they're going to be quote unquote vaccinated or immune against it in the future. Or what we can do is artificially help the body learn about it by giving them the chickenpox vaccine, for example. There's other what we call more passive ways of getting immunity. For example, when her mother passes quote unquote what we call antibodies, which are the fighting proteins in our body, and when it's passed down in pregnancy from the mother to the fetus, as well as other times. For example, when you get bitten by a snake and you go to the emergency room, and the emergency room gives you an immune globulin, which is to help bind against the snake venom. Those are all different ways of creating immunity in our body, per se. The body's immune system, and I'm making this a little bit simpler than it actually is broken down into T cells and B cells, which are different types of immune system. The easiest way to remember is the T cells is what creates the memory for the immune system. When the memory is created for an immune system, the next time the body is encountered with a particular kind of virus or bacteria or any other diseases, it remembers, and therefore it can mount a better, more stronger and robust immune system against it. What we're talking about with vaccination is allowing the B cells with the help of the T cells to help create like memory for these things. Now, antibodies is a term that I've kind of used, but basically simply said, it's just proteins in our body that help us fight basically different diseases. There's the IgM, which is basically happens early on. Think of it that these are like the first troops in the infantry that go out and fight the infection. And then the IgG, which is the reinforcements that come later, per se. The importance of creating a very robust immune system can be demonstrated in this chart right here. Primary response is when you first get exposed to something. So for example, the first time you got exposed to chickenpox, or the first time back in the day when there was measles there or polio, the body would create an immune system, but it would not be as robust. So we would start out with the IgM, and as that fades, the second, what we call quote unquote troops may come in and help fight the immune system. However, the body remembers then. This can be done either through vaccination or through natural exposure, as we talked about. And the second time, you can see that the immune system is a lot more robust. As you can see, this curve demonstrated on this chart is much, much, much higher. And the body creates a more robust and a better immune system and helps us clear the infection a little bit better. Therefore, second time you may be exposed to certain diseases, you may not even feel it, because the body is so adept at creating this immune system, per se. I want to spend a little bit of time just talking about this little cartoon right here. So this basically breaks down, this is analysis of the coronavirus infecting our cells. So the coronavirus basically has a spike protein, which can be used as an antigen. Antigen is something that basically may spark the immune system to be active. That's the analogous term to it. And then the virus infects the body, it infects many cells. As we know, with coronavirus, it can affect multi-organs in our body, and therefore can lead to active disease with damage to multiple organs, mostly the lung. But as we know from research that we've been seeing over the last few months, it can affect even the brain, other parts of our body as well. Now, the body will eventually learn this immune system, but at the cost that it may have caused damage to other organs. So this way, even when somebody recovers from coronavirus, they do have a little bit of immunity that is created. The goal of vaccination is to help cut down this storm that happens when you're naturally exposed to coronavirus, and instead give these cells a way to remember what coronavirus would be in case they did get exposed to it. So almost like you're doing a lot of the work for them without the collateral damage. Now, vaccines come in many different forms. We've been vaccinating people for many, many years, as Dr. Salehmohamed talked about smallpox. But when people go to Tanzania and Kenya and need to get the yellow fever vaccine, That's a vaccine right there. It's an example of what we call a live vaccine, where they take the virus and they make it a little bit weaker and expose it to the body. So this way, when the body encounters the real yellow fever, it's ready for it, basically. All right, polio vaccine, very, very common example. MMR, which is measles, mumps, and rubella. The disease may fully be eradicated, if we continue to vaccine. We know that the incidence has significantly decreased with the advent of vaccinations. Diphtheria is another example. It's a disease we rarely see in the developed world because of vaccination strategies. Now, I just put some of the examples that are out there in order to demonstrate that there's many different ways to deliver the vaccine to us. We know that the coronavirus vaccine, the two most common ones, which is the Moderna, as well as the Pfizer-BioNTech vaccine, uses mRNA technology. So mRNA is basically a piece of strand which has genetic material on it. As we all know, the DNA is the building block of our body's genetic code. But when the DNA needs to replicate it actually, or copy itself, it actually changes to something what we call mRNA, and an mRNA encodes proteins then after that. So it's something, a common question may be, well, if you're using genetic material, will it incorporate in my DNA? And the answer to that is no, because you're already one stream down and you're not incorporating into your own body's DNA. So the first vaccine, which is the most common vaccine, was the first one to get approved, was the Pfizer-BioNTech vaccine. Now, I have to say that the trial is ongoing, which means they're still monitoring the patients for any adverse effects or side effects that may happen after the fact. I'll translate some of these words for you so it makes a little bit more sense, but a multinational means it happened in more than one country. A placebo-controlled means that they divided up 43,000 patients into patients that may have received just saline and another group that may have received the actual vaccine itself. When we use the term blinded, we means that neither the participant nor the person who's administering the vaccine knows which one they're getting. And that is to obviously decrease bias, because sometimes people feel, well, I got the vaccine, I already feel much better. So in order to minimize that bias, most studies are blinded for that reason. The Pfizer vaccine was one of the few studies that used patients that were 16 and older instead of 18. And once again, as we mentioned before, it's an RNA type of vaccine, which is enclosed in an envelope, which is like a lipid nanoparticle. The Pfizer vaccine was 2 vaccines 21 days apart, which is slightly different from the Moderna vaccine. Most of the vaccine recipients did have some local reactions, such as pain, redness, and muscle pain at the site where the injection was delivered. Some patients may have also had a fever and generalized aches a day after the vaccine was delivered. Once again, more common after the second shot was delivered, but nonetheless, this was something that was seen in the study, more than what we call the placebo, which you wouldn't expect any adverse effects there. What we showed was the vaccine already showed protection 12 days after the first shot. More and more, in order to increase the number of people that we're vaccinating, Canada as well as the United States may be switching to a one vaccine approach initially and then worrying about the second vaccine down the line in order to get a maximum number of people vaccinated. The reason for that is because we saw that even with the first shot of vaccination, there was some immunity that conferred after that. With the second shot, of course, it went over to over 95%. This is just a brief diagram of basically they were injecting the RNA with the lipid particle into the cell, and then the cell then creates the word that we use, the antibody, basically to help fight the virus in case you were exposed to coronavirus. And as you see, the little table that's down there, it showed that patients who were diagnosed with COVID, there were only 8 in the first 120 days versus patients who did not get the vaccine, 162. And more importantly, I think patients with severe COVID symptoms, there was only 1, which happened really early on after the vaccination compared to 9 or more. Now, they followed the patients for at least 120 days out. So we have data for over 4 months out. And as you can see from the division of these two curves, the placebo are the patients that did not get the vaccine versus the red line, which is the patients that did get the vaccine. And basically what this table shows is that you're more likely to get COVID when you did not take the vaccine. Switching briefly to the Moderna vaccine, which is the second most common or the second one to get approved. They used about 30,000 patients. Once again, they also used a placebo, which means that some patients did not get the active vaccine versus some did get the active vaccine. This was 2 injections about 28 days apart. The advantage to this vaccine compared to the Pfizer vaccine was its storage issue, meaning that the Pfizer vaccine needed to be stored at -70 degrees when it was stored. However, it can be out for a few days, prior to vaccination, but this one could be stored at the regular freezer temperature, which is about 2 to 8 degrees Celsius and about 35 degrees Fahrenheit per se. Once again, local reactions were probably the most common adverse effect, side effect of the shot, which is basically you felt tired, my body hurts, my joints hurt, a little bit of headache, and a little bit of fever. Once again, consistent with the other vaccination with the Pfizer, more commonly after the second shot. 94.1% efficacy, which is also very fantastic. Putting these numbers in perspective, normally with vaccines, you're happy with the 60% or 70% efficacy rate. So these numbers were fantastic compared to other vaccines that we have had in the past. I'll touch on this point a little bit later on, but once again, the Moderna vaccine as well as the Pfizer vaccine, we don't know the impact on transmission quite yet. We know that it provides good immunity to the patients that do take it, but we're not sure if it will help reduce transmission quite yet. Once again, looking at these two curves, what you're looking is the separation of the two curves. And once again, you're going 120 days out. The first curve basically shows the curve starting at 28 days, which means that that's after the second shot of vaccine was delivered. You can see that the separation is a little bit more stark versus in the bottom curve where they started at day 0, which is when the first shot was administered. Regardless, they kind of show the same thing where you see a division in the curves where the top line, the darker line, you're more likely to get COVID versus if you don't take the vaccine versus if you take the vaccine. When we talk about side effects, once again, these were very similar to the Pfizer-BioNTech study as well, where more people who took the vaccine got side effects compared to the placebo, which is obviously expected. If you look at the brief summary of the results, you can see that the patients who got the Moderna vaccine had less cases of COVID, but more striking also was there were no cases of severe COVID. When we mean severe, this means patients who required hospitalization where we had to put a breathing tube down their throat because their lung disease was so bad from the COVID. Lastly, the last vaccine I want to talk about today is the AstraZeneca and the Oxford vaccine, which was just recently approved in the UK. It was sponsored actually by the UK in order to vaccinate as many people as possible, but it was studied in Brazil, South Africa. They used 18-year-old patients. This is slightly different technology where they actually use the RNA material, but they used actually another virus called adenovirus, which is a very common cold kind of virus that doesn't cause a lot of, most of the strains do not cause any pathogenicity or severe disease to humans. And they put the RNA into the adenovirus and then injected it into patients. And basically that's another way to deliver, basically, instead of using the lipid particle, they use another virus to deliver the RNA there. This was about 11,000 participants, and it was a single blinded study, which means that the patients did not know if they were getting the vaccine or the placebo, which means that if they just got saline or something else. There were many different, they did the study slightly differently in Brazil versus South Africa. Some patients got the meningococcal vaccine instead of just regular saline. which is a common vaccine that we get before we go to Hajj or before we go to Northern Africa. It's a vaccine that's been around for many years. Once again, this was 2 shots, 28 days apart. This is a brief schema of how they used it. So basically the small arrow, I don't know if you can see it, but basically is the RNA material from the coronavirus. They put it in this virus called adenovirus. The adenovirus then infects our cells, but doesn't cause any disease. And it allows to make the antibodies, which is those little Y-shaped things that you see on the cell. And that, remember, is the protein that helps protect against diseases. Once again, then these tend to go to fight the cells. It creates more antibodies, creates a very robust immune system, and it can actively fight the coronavirus cell versus also directly fight the cells, as well as make antibodies to fight the cells. So it's just slightly different, but the concept is about the same. Once again, this curve is very similar to the other curves that we saw. And basically what you see is a deviation of the 2 curves, where we see that you're more likely to get coronavirus if you just got the meningitis vaccine versus if you actually got the vaccine. Now, their results were not as robust as the Pfizer and Moderna study, but still they were in the 70 to 75%, which is still pretty good. Still very, very effective. And the other advantage was this could be just regularly refrigerated. It did not need to be frozen. And the other advantage of it is you may not need a second shot. What they saw when they did what we call post hoc analysis, where they went back and looked after the first and second phase of the trial, is they demonstrated that people could need only half the dose as a second dose. So there was immunity even from the first dose itself, which is a very important public health strategy, because what we can say is even if with one vaccine, you're already conferring some immunity. Now, how do we go about distributing these vaccines? Now, obviously, if people want all these vaccines, there's no way we can give everyone the vaccine all at once, kind of thing. As we get more vaccinations, we will be able to generally vaccinate the mass public, but obviously there has to be some kind of tier strategy. So the ACIP, which is the Advisory Committee on Immunization Practices, which is in the United States, basically came up with how it should be delivered. And this is very similar to Canada as well, as well as in the UK as well, where initially they offered it to healthcare personnel as well as long-term facility residents. What I mean by that is assisted living patients, as well as nursing home patients. Dr. Mithani will touch upon this a little bit later, but this population was very, very hardly hit by this coronavirus, and it spread very quickly in the nursing homes as well as the assisted living facilities. So healthcare personnel who are in the first line, and even within healthcare personnel, there's been a tier system in there where they're giving it primarily to ICU doctors, ER doctors and nurses, as well as other people who are on the front line, compared to maybe other healthcare workers who are not on the direct front line. There's also a tier system within that as well. Then the next phase will be people above 75, as well as non-healthcare frontline workers. These are like policemen, fire department, people who come in contact with a lot of people, grocery store workers. Then the third, what we call 1C, which is still part of the first phase, but the third tier of it is slightly younger patients, 65 to 74, who are still at risk, as well as 16 to 64, who have very, very high risk medical conditions. Patients who may have cancer or recovering from cancer, patients with bad lung disease, for example, who even a mild case of COVID or mild case of coronavirus may be very detrimental to them. And then phase 2 is basically all other persons who are 16 plus. Like we talked about, Pfizer was the only study to include 16 to 18-year-olds as well. There's not much data right now on patients who are younger than 16 years old. So there's no guidance from the ACIP regarding if patients less than 16 should get vaccinated or not. Therefore, there's ongoing clinical trials in terms of whether it's going to be safe in the pediatric population as well. There are many other vaccines that are on the horizon for now, and we will know more as we get a little bit more data that's a little bit more clear from them. So the research is obviously ongoing. People may have heard about 2 days after the UK started their mass vaccination campaign, there were 2 incidences of severe anaphylaxis from this vaccine. May have been coincidental, but they did create, for the Pfizer vaccine, they did create a little bit of a memo that patients who have many different allergies, there's some patients who unfortunately have are allergic to many different things and high risk for anaphylaxis for certain things, they advise they should forego the vaccine for now. That being said, the incidence is extremely, extremely low. It's slightly higher than traditional vaccines, but for the most part, it's still very, very low. Next question that people ask is, well, what about pregnant patients? The American College of Obstetricians and Gynecologists recommended that the vaccine should not be withheld from pregnant patients. The reason for that is some patients may be in a very, very, very high risk group despite being pregnant and stuff. That being said, there was no data on using pregnant patients in the studies as well. However, that being said, in the Pfizer study, there were about 4 or 5 patients that did get pregnant during the study, which means that they had already received the first vaccine, and then during the follow-up period, they were found to be pregnant as well. So I know there have been some myths about it causing infertility and causing issues with pregnancy per se. That was not demonstrated in this study. But that being said, there's still a lot of data that needs to come from specifically for pregnant patients as well. How long will the protection last? Some people say that, well, if I get this vaccine now, then what happens next year? Will I have to re-get it again, or will I need another booster? Will I need only 1 shot? The answer is we don't know. We know that all these studies went out for at least 4 months out. So we know that it will provide you with some protection, at least for the time being, per se. The studies are ongoing, which means they're going to follow the patients for at least 2 years. So we'll know next year if their antibody levels are lower. So we'll need to know if we need to get another booster in the future or not. Do I still need to wear a mask? The answer to that is yes. So as we talked about briefly before, the vaccination helps create an immune response in you, which means it creates these proteins called antibodies like we talked about without you having to deal with the sickness or the collateral damage that it causes. That being said, we don't know that if you do infect the virus, whether you'll still pass it on to many, many people. You may get a much, much milder form of COVID because your body has an immunity to it now, but or has a robust immune system and is vaccinated against it. However, you may still shed in an asymptomatic form. Therefore, the data on transmission, I would still say, is still in the air. So for the time being, if you do get vaccinated, you get both shots, the recommendations are still to continue wearing the mask, as well as continue to maintain social distance, sanitize your hands, same thing that we're doing. To get to a point where the mass population is vaccinated, we're looking at it, we need to vaccinate at least 70% of the population before we get to a point where is the magic term that people may have heard of is herd immunity, which is where enough people are vaccinated against the vaccine or have experienced the disease enough that the rate of the COVID in the community is at a controllable level. What if I've had COVID already? A lot of patients have had COVID and recovered from it, and now they may be up for the vaccination per se. We know from past experience that patients that were sick in March, April may have recovered and then gotten vaccine again in November and December, as well as in January. So we know that there is reinfection that occurs. We know that there's different strains per se of the of the COVID. Therefore, the recommendations is still to get vaccinated against it. We also know that the immunity fades. We know that patients who got sick in March, April were getting sick again 6 months later. So we know over a few months, the natural immunity does wane. The vaccine will allow you to boost that immunity even up more. All right, so I'll leave it up here. I left some helpful links up there. The most important thing is to get credible information. There's a lot of misinformation with WhatsApp groups out there, Facebook, there's anti-vaccination campaigns. What I would probably urge you to do is look at reliable resources. The same way how when you guys are looking for Islamic ruling and you need to look at a reliable source, the same way, look at the science, make an informed decision. Don't just look at a WhatsApp and say, oh my God, they're infecting us and I'm not gonna take the vaccine. I think make an informed decision. My role here was just to provide you with the information and provide you with the facts, but everything is out there in the internet. You look for reliable resources where you can actually do your research on and stuff. All right, thank you, Baqer.
Brilliant, that was amazing. Thank you for that, Dr. Dharsee. I think we need to look for a new vaccine. I want to get rid of my mask. I think that's the major thing for me. If I may ask Sayyid Mohammed Rizvi to give us his views, please, Sayyid, if you wouldn't mind unmuting yourself. Thank you.
أعوذ بالله من الشيطان اللعين الرجيم بسم الله الرحمن الرحيم الحمد لله رب العالمين والصلاة والسلام على محمد وآله الطاهرين. Assalamu alaikum wa rahmatullah, everyone. I would like to thank the organizers for this opportunity to talk about this important issue. I think Dr. Arif Dharsee coming before me was very appropriate here to talk about the in a way, the history of vaccination and comparing with the pandemic, which happened almost a century ago, and the reaction at that time, especially when you mentioned Montreal, even the same things are happening now in Montreal. The people are campaigning against this whole issue of vaccination. And especially, it was good to debunk the messages which are going around in the community, also on the WhatsApp group, social media. It's interesting, just yesterday, anticipating that I'll be participating in this program, a brother, a very sincere brother, out of his sincerity, he forwarded to me a message from WhatsApp saying that the UK government has declared that basically the vaccine is not safe. And so at least that forced me to go to the UK government website to look at the information there about both companies, whether it is Fraser or the AstraZeneca. And I looked at what they have mentioned, possible side effects. And, they're saying that since this is a very new vaccine, there's not enough data to talk about every, possible side effect. And so there's left things open there, but that doesn't mean this is harmful for pregnant women, for example. And that's where, they take the same information from the government website, but then present it in a very, negative way. And this is where I think the community has to learn. Just as I say that, when it comes to the Sharia matters, don't go by this trend of, Mullah Google. There is no Mullah Google out there. You have to know the authentic sources of Sharia laws. Similarly, we see when it comes to the medical science, you have to go to the authentic sources and not just go with, whatever you see in the web, whether it is in internet or social media. And so this gives you an opportunity to maybe to talk about this vaccine as far as the Sharia perspective is concerned. It's interesting that we saw just over the Christmas weekend, some questions were formulated by the Islamic Education Board of the World Federation, sent to office of Ayatollah Sistani in Najaf, and they got the response, which was very timely for our program here. And so I don't just have to talk about from what I understand to be the fiqhi perspective in line with the understanding and thinking of the Grand Ayatollah Sistani. Actually, we have the statement from his office. And I'll just, talk about two things from there before I come to a very general statement about this whole issue of vaccination from religious point of view. It's interesting to see that in the very first question, they have talked about whether we should be going for these vaccines produced by Pfizer or AstraZeneca or Moderna. And it's interesting that when they talk about the possible side effects are there because the data is not that sufficient to give a definitive, response to all these questions. And so this is where, it's very interesting the way the answer comes, that you have to look at the, in fiqh we have a term, and it's not mentioned in this answer, but this is the rationale behind it. There is something known as aham and muhim. Muhim means something which is important. Aham, which means something which is more important. So sometimes you might be faced with a situation where you have to make a choice between what is important and what is more important. You can't have it both. The situation is such, and this is where the Sharia says you go with what is aham, which is more important, and you sacrifice the option which is only important. And on the level of comparison, and this is where Ayatollah Sistani responds there by saying that number one, it is appropriate to rely on the advice given by the experienced medical experts. Again, this has been his constant advice on this whole issue of the pandemic, that listen to the guidelines of the medical experts. And this is Sam is saying that number one, rely on the advice given by the experienced medical experts. And as far as the Sharia is concerned, if you look at the issue of the suffering from the coronavirus versus the potential side effect, which we are not sure about it, the potential of the harm and especially death caused by the coronavirus is something more important to be taken care of than potential side effects. And therefore he says it becomes mandatory to use the vaccine. Another issue which comes from the Sharia point of view is people would be saying, what if it has contains some of the elements in the ingredients from animal product or from pigs, for example. Well, that was the last question there among the 5 questions that they sent. And the answer is very brief, very clear. He says, in all circumstances, there is no legal Shari'i objection. Means whether they are istihala takes place or not. First of all, on the issue of istihala, there is a kind of difference of opinion between Sayyid al-Khawi, who believed in the istihala in the process of manufacturing gelatin. This was actually an issue. I had written a paper on it in mid-80s, saying that when the gelatin is produced, it goes through istihala, and it is okay, even if it comes from a pig source. Ayatollah Sistani's bar or the standard of istihala is actually higher than al-Khawi. And on this issue of gelatin, he basically says that from his perspective, the level of istihala is not good enough to make it pak. But then in the letter, answers to the questions on this same issue in the last few years, I've seen is kind of leaving it to the individual to make the decision whether istihala has taken place or not. And istihala here, basically, we are talking about kind of a change, that it is no more known as the first original entity. And so even if the istihala doesn't take place in this case of vaccine, even if it comes from an animal product, Ayatollah Sistani says there is no Shari'i objection to it because of the seriousness of the problem. Because if this is the only vaccine which is available there, then there will be no problem in using it. And so this is something we have to, realize that from the Shari'i point of view, that there would be no problem in it. One more issue which has not come up, and I saw that in the vaccine produced by AstraZeneca, there is a very small amount of alcohol involved in it. And it is a very minute amount, 0.002 milligram of alcohol per dose. And that amount is very minimum, and it wouldn't have an impact on the rulings of the fuqaha, especially the Grand Ayatollah Sistani. Actually, he considers alcohol to be haram for consumption, but not najis. Let me clarify it, because people will get confused here. What am I saying? Something can be haram, but not necessarily najis. Something could be haram as well as najis. Majority opinion of the Shia fuqaha is that alcohol is haram as well as najis. But Ayatollah Sistani is among those minority, him, and even in the earlier scholars, we have Sheikh Saduq, for example, very early, who believed that alcohol was haram, but it was not najis. So from the perspective of Ayatollah Sistani, it's not an issue of najasat there for alcohol, and even from the perspective of other fuqaha, because the amount is very, very minute, 0.002 milligram. This is where it wouldn't have any impact as far as the hurumat is concerned. And so from the Sharia point of view, the vaccine would not be a problem at all. I'll just end with a statement, trying to explain the role of vaccine with what happens on a spiritual world. We are told to maintain our body as an amanat and trust that Allah has given to us, as well as to safeguard the purity of our soul and our nafs. Both are very important. So you have the body and the soul, and we have to protect both of them from deterioration and corruption. And when we look at the issue of the body, of course, there are two important things. Number one, we have to provide the nutrition which is important for the body to be protected and grow, and also protect from the elements which will cause disease and sickness. And this is where we sometimes, when it comes to the issue of protection of the body from the illnesses, in many cases we deal with individual disease in one by one, and you have a medication for this and that, but then you also have these vaccines which are even given to us from our childhood to protect us from certain things which are very common. Similarly, when it comes to the element of nafs and ruh, the soul and the purity of the soul, we have to provide the nutrition for growth of our soul and our nafs, and that is by what I would borrow here a term from Amir al-Mu'mineen, where he says ada'ul fara'id, that we should fulfill our duties. Once we fulfill our duties, this is where the nafs gain its nutrition and strength to survive and maintain itself. but we also have to protect it. And that would be by ijtinab al-maharim, by refraining from what is haram, because that can be a cause of corruption for the the soul. And Amir al-Mu'mineen has a term in Nahj al-Balagha where he says, remember, if you want to protect your soul, there is, instead of just going with one challenge after another and dealing with them, there can be an overall, protection against the from the sins, and that is known as taqwa. I consider taqwa to be the spiritual vaccination for the soul. So if you have taqwa, then all the problems will be, resolved in that way. And so when we talk about, the duty of protecting ourselves physically, vaccination becomes an important part of the overall duty that we have towards, protecting ourselves on a physical level. May Allah subhanahu wa ta'ala, keep all the mu'mineen and the entire humanity against this negative impact of the coronavirus. And we pray for the protection of everyone, inshallah. I'll conclude that.
Inshallah, Ilahi. Thank you very much, Sayyidina. Last but not least, if I may ask Dr. Akber Mithani to give his views, please.
أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم الحمد لله رب العالمين والصلاة والسلام على أشرف الأنبياء والمرسلين شفيع المذنبين وخاتم النبيين نبينا وشفينا وحبيب قلوبنا وطبيب نفوسنا أبي القاسم المصطفى محمد اللهم صل على محمد وآل محمد وعلى أهل بيته الطيبين الطاهرين المعصومين المنتجبين أما بعد. Sayyid Muhammad Rizvi, brothers and sisters in Islam, Salamun Alaikum Jami'an wa Rahmatullahi wa Barakatuh. I'm going to focus, of course, on the most important population with respect to this vaccine, and that is the seniors population, the elderly population. One of the things that we do know about COVID-19 is that the majority of people who have been infected with COVID-19 that have seen very severe adverse reactions to this disease is the elderly population. The other thing that we also know is that the incidence of COVID-19 in nursing homes and long-term care facilities are much, much higher than in the regular population. But the important thing is to understand that the virus that comes into the long-term care facility actually comes from the communities, the community transmission that brings the virus into these facilities. And once it comes into the facilities, this population, if they get infected, the outcome is very, very severe for them. It's important to understand that most of the deaths that have occurred as a result of COVID-19 overwhelmingly has been in the elderly population, has been in the seniors population. And if you look at the ICUs, and Dr. Mustafa Salehmohamed will tell you that a lot of the people who need ventilation, who then end up dying, as he mentioned earlier, that has overwhelmingly been on people who are elderly and who are in the seniors age group. So this virus has really hit this population the worst. And especially if you have elderly population that have other illnesses, other coexisting illnesses, as most elderly people do, it tends to severely affect this population as well. Another important issue that we really need to understand, and as Sayyid himself, speaks about the, Agha's ruling with respect to the effects of coronavirus versus the side effects of the vaccine, it's important to also contextualize this with the effect of coronavirus and effect of COVID-19 on our seniors, not only when they have become infected and have ended up in ICU or has resulted in death, but the other devastating effects that COVID-19 has had in this population, especially with respect to their mental health wellness and mental health illness. The loneliness that they have had to endure, the hopelessness, the helplessness, the social isolation because of restrictions in family visitations. Nobody can visit. You know, we've ended up with a physical lockdown. And for our senior population who have overwhelmingly relied on centers and being able to come to centers and do their worship and be able to interact with other people, they have not only, you know, undergone a physical lockdown, they have also now endured a spiritual lockdown as well, where they are not able to express, you know, the worship and spirituality in the way that they have been able to before, and they have not had any family visitations and so on and so forth. So I think the important message that I want to give is that this vaccine is critical for the seniors population to have, not only to prevent hospitalizations and death, but also to prevent the adverse consequences to their mental health and spiritual well-being. It's very, very important we understand that, especially for this population. The seniors, of course, as Dr. Arif Dharsee has mentioned, are going to be the first priority. Certainly in Canada, it's going to be the long-term care facility residents, the nursing home residents, assisted living residents who are in the first phase of vaccination with, of course, frontline healthcare professionals and so on and so forth. And similar to what the United States is doing, there is going to be a system, a tier system, where then seniors at the age of 80 and over will be first, given priority for the vaccine, and then so on and so forth. There are different levels and tiers that will go on. I think here, one of the important messages is to really express to our communities in NASIMCO across North America that our communities need to be prepared to assist our seniors in order for them to get their vaccines in a timely way. So, because a lot of the appointments for these vaccinations in the clinics are going to be done online. Some of our seniors may not be as tech savvy and so on and so forth. So I think whenever a particular group of seniors becomes eligible for the vaccine, it's going to be important that our communities have systems in place where they are registering the seniors in a timely way to get the vaccine. And then they are also having to make sure that they are getting the seniors to the clinics in a timely way, and that may involve a lot of logistics and so on and so forth. But I think our communities need to be prepared for this so that our seniors can start to have this vaccine in a timely way and get protected so that they can come out of this isolation that they're going through right now. I want to also add one thing, and that is that despite what you may hear, and even within the Pfizer vaccine and the Moderna vaccine, which are the two major vaccines right now approved in Canada, maybe the AstraZeneca will come pretty soon now that it's been approved in the United Kingdom. The overwhelming majority of the seniors will be eligible for the vaccine. There are precautions and things that are listed. The real contraindications to the vaccine are very, very small. There are very few people who are actually allergic to the components of the vaccine. And I think some of the precautions are listed if you're immunocompromised or if you have an autoimmune disorder and so on and so forth. I mean, you definitely should check with your physician, but even people who are immunocompromised or mildly immunocompromised, will still be eligible for the vaccine. The only thing is that the vaccine may not mount a robust immune response, but there is really no major downside to actually getting the vaccine. So my really strong plea to our communities is, let's make sure our seniors are ready, so that they are ready to receive the vaccine. Make sure we put the logistics in place, understand that the effects of the vaccine go beyond just the horrible effects of coronavirus infection around hospitalization and deaths, which is the highest in this population. But do not forget the devastating mental health and spiritual ramifications of having this illness. So vaccine becomes critical in this population, and we need to do whatever we can to encourage our members of our community, our elder members of our community, to receive this vaccine. Thank you very much.
Thank you, Dr. Mithani. That was really amazing. I'd like to open it up for questions, and trust me, there are many that have come in. So brace yourselves, guys. But before that, I'd like to read this next paragraph. This webinar, I want to remind everyone that this webinar is intended to provide you with both medical and religious perspectives on the COVID-19 vaccine. The information you hear today is not a substitute for any professional medical advice, diagnosis, or treatment. We strongly encourage you to consult your doctor or other medical professional regarding the COVID-19 vaccine or any other medical questions you may have. So, having said that, I think we have a question for Dr. Arif. Salam, Dr. Arif. What do we know about our immune system itself being attacked by the virus and turning it against itself? We know that during cytokine storm, our immune system is more damaging.
So that is a fantastic question. So we've learned that over the last few months, as we taking care of more and more COVID patients, we know that the COVID virus actually almost like sparks a very robust immune system per se. So what it does is, this word that they use, cytokine storm, is exactly what it is. So part of, in my presentation, I didn't go in too much detail about it, but there's many different types of immune cells that are out there. I minimize it to just to simplify it with the B cells and T cells, but these have many other functions, not only in memory of our antibody. One of the ways, as I talked about early in the slide, is something what we call the innate immune system, is the body creates cytokines. Cytokines are also little proteins, such as interleukins, that create many different things in the body. So one thing, maybe it actually causes a fever. By causing a fever, it actually raises the body temperature to help fight infection per se. So the same way, this sometimes what can happen in certain types of infections, this immune system gets a little bit out of hand. And what we noticed in COVID patients is that, especially in the lung, the storm kind of gets a little bit out of hand, and it tends to affect our body's immune system per se, in terms of like affecting other organs. So we saw that patients that were extremely, extremely ill from COVID ended up going into kidney failure, ended up going into lung failure, where basically they could not breathe on their own. And then they go into even something what we call circulatory failure, where the body cannot even maintain their own blood pressure per se. We know that once the body gets into a lot of these conditions, the risk for what we call mortality, or the risk for death, is extremely high. So we know that the COVID does this, and some of the newer strategies that have been there in treatment, or I should say management of COVID, has been to ramp down this immune system per se. So there's different branches of the immune system that it does different things. So what we're talking about here is more of the effect of the COVID itself. And going back to the slide that I showed earlier, the whole point is to try and get the cell to remember what COVID looks like without actually going through the whole side or the whole effects of damaging our body. Great question.
Thank you. So I believe then naturally the question becomes, do we know, did this science just develop out of the blue after COVID, or did we had this and it just didn't come in the forefront?
Right. So a lot of the research development happened during when we had different kind of coronaviruses before. So if you guys may remember that about 20 years ago, we had another strain where SARS first came out, where it was a very infective strain, which was the first kind of what we call novel coronavirus that came out that made headlines. It was the doctor who went to Hong Kong, he went to China, and he infected a lot of people in that particular area per se. But then that particular virus was contained, and it was a very deadly virus, and it killed a lot of people in that vicinity. But then it was almost self-contained, and then it kind of went to the side. But then also, about 8 or 10 years after that, we had the development of the MERS coronavirus, which is Middle Eastern Respiratory Syndrome coronavirus, which was actually an outbreak in the Middle East countries where they had a similar kind of intense respiratory or intense lung kind of virus, very similar to the coronavirus that we had right now. But once again, once that outbreak was contained in a few months, it was kind of put to the side. So those diseases already kind of started the research for looking into different kind of vaccine technologies for this, in case there was another outbreak for another novel coronavirus per se. We know that all viruses mutate per se, which means that, think of it in an example, if you had to copy a page, verbatim to another page, you're going to make some mistakes. So the same way as viruses replicate, as viruses, copy each other, they're going to make some mistakes. And when they make some mistakes, they end up mutating a little bit per se. I don't know if that answered the question. So that was already kind of in development a little bit before this most recent, effort, I should say, global effort in trying to develop these new vaccines. One of the skepticism maybe out there is like, well, we've only been developing this vaccine for only 6 months. How can we trust it per se? And a lot of the research had already taken place, but when you put all the world's effort into one problem, rather than everybody working on their own thing, I think you're going to get a lot more remarkable results.
Yeah, I think the last part actually sums it up very, very well. Thank you for that. Okay, so the next question I have is, and this is not from me, I am actually disclaiming that right now. I have heard that the vaccine interferes with plastic surgery, such as Botox. Anyone?
I'll take that one. There is no evidence whatsoever. I mean, it's an interesting question. It's an off-the-wall question a little bit, but it's there is no evidence that it interferes with any of these kind of procedures. Obviously, there's not enough studies to be done on that many plastic surgery patients with getting Botox and the vaccine. But as of yet, the mechanism of this, the science of this, does not support anything like that where it says it'll affect anybody who's gotten Botox. Will there be certain side effects? Absolutely, there's going to be certain side effects that Dr. Dharsee spoke about. But to date, we have no evidence that it affects anybody who's gotten Botox and will be getting the vaccine as well.
So I think I shouldn't worry about it too much, then I should go ahead and do it. Thank you. Okay, the next question I have is, does the vaccine protect us from new strains of COVID-19?
So there's been some research recently, or some more information in terms of the virus mutating, which is something that we expected. We know just clinically looking at how the patients who are back in March, April to where they are right now, they are behaving slightly differently, I would say. So this was an expected phenomenon, as we know a little bit more information, that there may be another variant or another slight variant of the COVID virus. Now, that being said, if you look at the genetic material that was discovered for the new strain of it, majority is the same. About 99% of it is relatively similar. There's some reports that it may be slightly more contagious, but not more deadly. As far as if the vaccine will be effective against it, the vaccine is targeting something what we call the S protein on the surface of the virus. Now, the coronavirus, the whole family of viruses share this particular protein on there. So am I going to say with 100% certainty it's going to protect against it? No, I cannot say that, but very likely it will confer some immunity to it. Obviously, there's more studies. There was actually a statement released by the BioNTech research head, which did say that they're looking into this new virus and they're comparing it to the antibodies that were created. But they are confident that it will continue to provide immunity towards, with this vaccination, you should confer some immunity to the new strain as well.
Brilliant, thank you for that. Dr. Mithani, question for you. Should we wait until we have enough data about the side effects before taking this vaccine, especially for the elderly?
No.
that was really emphatic.
No,
so
I mean, you know, I think, I mean, really, if you look at the vaccine, the way it has been studied and the number of people it has been studied in, it's pretty comparable to other vaccines. It's what they've done is they've studied it in a shorter time frame. This vaccine is, or at least the two vaccines, I mean, I can really only talk about the two vaccines that have currently been approved in Canada. I mean, unless you know, our authorities end up approving the third vaccine, which is probably going to be the AstraZeneca Oxford vaccine, and as Dr. Dharsee said, the mechanism is a little bit different, well, quite a bit different from the messenger RNA vaccines. The side effects of these vaccines are very, very much lower than, you know, getting the infection. You see, you always have to weigh the risks and benefits, right? So you cannot say the vaccine does not have any side effects, but overwhelmingly the side effects are very minor. They're local, it's pain, a little bit of fever, maybe some muscle aches and so on and so forth. And you see that in the elderly population. But the consequence of the infection with coronavirus or with COVID-19 is devastating in this population. So my answer is an emphatic no. I would not wait. I would get this vaccine as soon as it is made available, because getting COVID-19 is going to likely put you in a far greater risk of death and hospitalization than getting the vaccine with some minor side effects.
Fair enough. Thank you for that, Dr. Mithani. Sayyid, now a question for you, and this is really interesting, actually. If Hajj is allowed for vaccinated Muslims this July and masks are required, then would it be okay to use it when in Ihram? Sorry, Sayyid, now you are on mute. Could you please unmute yourself?
Well, I think just as, you know, the Hujjaj prepare themselves for all different kinds of preparations before Hajj, they even go for vaccinations of different kinds. Even this is something that they should do ahead of time, so they don't have to go into a situation of getting the vaccination when they are in the state of Ihram. I don't know what are the regulations as yet, but I think maybe it might become mandatory for those who want to go for Hajj. They wouldn't get a visa unless they go through it.
Fair enough.
So do it before you go to put on the Ihram. Yeah.
Excellent. And just a subsequent question to that, to be clear, according to the fatwa, is it wajib to take the COVID-19 vaccine?
It is not wajib as in a sense that, you know, if you don't do it, then you are, you know, committing a haram. What it's saying, although the term used in the World Federation translation is mandatory, but basically what Ayatollah Sistani is saying that if it is a matter of, you know, looking at the danger of not having the vaccine compared to the danger of the side effects, you'll have to see what is lesser and what is more important there. And that's where he's saying it becomes, necessary. If even the word wajib has not been used, I was just checking that just a few minutes ago. He doesn't use the word wajib. He says lazim, which is kind of not necessarily as a wajib, but it is necessary to do this in order to protect yourself from a bigger harm compared to the lesser harm of potential side effects.
So pretty much what you were saying, and if I'm getting this correct, pretty much what you were saying of doing something which is very important and not the very important. So this is that very important. Excellent.
Yes.
Thank you for that. Okay, coming back to some of the questions I have on the medicinal side. I know that we've talked about other vaccinations. So I think I have two questions, and I'm going to put those two together. Are there more vaccines in the development? And the other question I want to ask is, can we also discuss the Chinese Sinovac vaccine? Is it safe, effective? Anybody wants to take that, please? Dr. Dharsee?
Yes. So yes, there's many vaccines that are out there that are in develop. There was one study that I think I read in New England Journal that about 100 candidates started out in like phase 1 and phase 2 trials. So there's a lot more that may be coming down the pipeline. Obviously, these three are the most ahead of the game right now, but there's many other ones out there as well. I think there's also 2 Canadian firms that are have started up that are looking to start vaccinating, and different ones are creating different technologies. The Chinese one per se, I know that the reports that I had read was that they were using an attenuated form of the virus instead of an mRNA, which basically means that you take the virus and you weaken it, almost like how the old shingles vaccine used to be, old chickenpox vaccine used to be, where they used to take the virus, weaken it so it doesn't cause disease in the body, and then end up administering it and to get an immune response that way. I do not have the data about how efficacious it is yet. I know that they've started their vaccination programs, but as early on, not to be a skeptic in certain things, but a lot of the early reports that were coming out of the China was very, I would say, it's the right word for it, but not 100% accurate, and you have to take everything with a grain of salt with the data that was coming out of there. So I don't have the exact efficacy numbers for that virus yet. I did read reports that they're using an attenuated form of the virus, basically. The downside to just putting it out there is the downside to using an attenuated virus is that you lose the ability to vaccinate a lot of the vulnerable population. So for example, a lot of patients who are on chemotherapy or have autoimmune disorders, you cannot even give them a weakened form of the virus, because in those patients, even a weakened form of the virus can cause actual disease and can be very harmful to them. So for example, HIV patients, chemotherapy patients, other what we call quote unquote immunosuppressed patients are at extremely high risk for these vaccines, and they're not able to use these vaccines.
Brilliant. So is there any plan-based vaccine then?
There are many researchers out there that are using different components of it. To use plant-based vaccines, you would have to use something what we call an antigen, which would be very similar to what the coronavirus protein would be. So at the end, you're using the same protein or similar protein to create an immune response, but the vehicles to enter the body, which means that how you deliver may be different. So that may be plant-based as opposed to using a lipid particle. And remember, lipid particles are naturally found in our body. All our cells are encapsulated by lipid particles. So it's not like so much like a foreign concept to our body, per se, but there's many different ways to deliver this vaccine. And therefore, as you can see, these are just the top 3 viruses. There's hundreds of candidates that are out there. And I think with time, we may get more and more data on these other smaller vaccine trials. Whenever somebody's doing these vaccine trials, you usually start out with what we call phase 1 and 2 trials, which means that initially they start out maybe in some animal models where they're injecting these things into animals to see if they create an immune response. Usually phase 2 is what we call more of a safety kind of protocol, where they use smaller populations to basically look at the safety of the vaccine profile. And then phase 3, which are the ones that need, which is right before the what we call FDA approval or the committee approval, where they use thousands of patients to look at the efficacy as well as the safety of the vaccine. And then there's something what we call phase 4, which is once the vaccine's already out, the vaccine company and the researchers are required to keep data on whether patients are having side effects from it or anything like that. So it's not like, oh, this is the end of the story and this is it. You know, there's still some ongoing research that still happens with this.
Brilliant, thank you for that.
Baqer, can I just
yes,
add
please.
a word in what we discussed earlier? I was just looking at the question answer from Ayatollah Sistani's office. Let me just repeat let me read the words here where it says, as per Sharia, it is mandatory to use an approved vaccine in a situation when the probability of suffering from the coronavirus infection with its potentially life-threatening or serious untreatable complications far outweigh the probable serious side effects of getting vaccinated. And so maybe this issue of whether it's mandatory or not, this would be more relevant to what Dr. Mithani was talking about, the senior population. For them, probably it would be lazim and wajib, because if they don't have it, you know, the consequences are very, very serious.
Very serious.
Yeah. So it depends on, you look at the age group and, you know, underlying conditions of the individuals, and that's where the issue would be, whether it is allowed or is it necessary.
And Maulana, it would also apply to frontline healthcare workers and those at-risk populations, don't you think?
Yes, definitely. Yeah.
Brilliant. This is great. Thank you, Mullah. Okay, so we've got just under 7 minutes of this to go. I'm gonna, and there are over 30, 40 questions that I can see right now. I think I'm just gonna pick and choose a couple now, if that's okay. So I know we've talked about, and there are lots of questions on this particular one. We've talked about the side effects of this. I believe that there's a question that has been asked. What about the nurse who collapsed from anaphylactic shock? Is that something? Okay, Dr. Dharsee.
Right. So there was actually, when the Pfizer-BioNTech vaccine came out, as I was alluding into my talk, there were 2 people who got vaccinated that had severe allergic reactions to it. Then there was a nurse in Alaska. From what I understand, she may have had some underlying allergies as well, but she did have anaphylaxis. So anaphylaxis means where it's like a sudden, what we call a more severe allergic reaction compared to anybody else kind of thing. So as I mentioned before, the number, when you're vaccinating a lot of people, you're always going to get 1 or 2 of these outliers where some people may have a little bit more robust adverse effect compared to the general public. So as I had mentioned previously, in certain, they did mention that patients with multiple allergies, including a history of anaphylaxis to something else. So for example, if you have a very severe peanut allergy, which is anaphylaxis, most people would carry an EpiPen with them, epinephrine pen with them, to help alleviate them of this allergic reaction. The guidelines right now say to probably avoid this vaccine for now. So there are a certain number of people that, you know, unfortunately, that is one of the Like I said, there's not many what we call contraindication is just a fancy way of saying that should not get the vaccine at this point in time. And that is one of them. Patients who have a history of anaphylaxis to something, or patients who have a severe allergic reaction to something, should probably avoid this vaccine for now.
Brilliant, thank you for that. I'm just gonna ask you the same this another question that is on the same lines, if that's okay.
Sure.
So the question is the important questions about these vaccines: severity of symptoms, hospitalization, transmission, prevention. Do they save lives? And finally, side effects. It says Guillain-Barré narcolepsy.
Okay, so once again, another good question. So if you look at the impact of what COVID has done, where the millions of people have died, and you look at like people are dying, thousands of people are dying every day from it, you know, and you compare it to most of the adverse effects that were reported were quote unquote mild, which means a little bit of arm pain, maybe some fever, maybe some redness at the site where you got the injection. I think there in itself lies that the benefits of it outweigh the risks of it, especially in the vulnerable population per se. They are with anything, with any medication that comes out there, there's always adverse effects. There's always risk versus benefit. So in your situation, in a person's situation where, for example, they have a history of anaphylaxis, for example, as we mentioned in the previous example, and you're otherwise healthy 30-year-old who has no other medical issues, staying at home, self-isolating, you're probably in that situation, probably the benefit of the vaccine is not so much as the risk. But if you look at the regular population, otherwise, we're interacting with a lot of people. We're not hermits. You know, we are being exposed to the virus out there. We all have some predisposing conditions that may put us at increased risk for it. And plus, we don't know. In some patients, yes, we have some risk factors in some patients where we know that coronavirus will create a little bit more severe disease in them. But for the most part, I saw 30, 40-year-olds dying, end up on the ventilator. I saw young 20, 25-year-olds getting COVID and dying, you know, versus when you balance that with the minimal side effects that are there, I feel like they definitely outweigh the risks. The benefits of the vaccine definitely outweigh the risks. Now, Guillain-Barré syndrome is basically a neurological disorder that was initially reported with some vaccinations, especially early flu vaccinations, did give you something what we call Guillain-Barré syndrome, which is what we call an ascending weakness, which means that your legs start to get weak and then your arms start to get weak, and it kind of takes over your whole body. Now that can definitely, that was not reported in these kind of things, but with previous vaccinations that was reported per se.
I
think I'll add on to that, if I may. Sorry, Dr. Mithani, go ahead.
No, go ahead, Mustafa.
So I just wanted to actually add on to that with the Guillain-Barré syndrome and the influenza vaccine and the anecdotal connections to that. There weren't large studies to connect that, as Dr. Dharsee will confirm. There's very anecdotal data on that. And, you know, so the message there to the viewers is speak to your physician, speak to your doctors, see what your medical conditions have been. If you've had a history of Guillain-Barré syndrome, it is something to take into account. But again, as Dr. Dharsee said, there's absolutely no data from these studies that have been done with these vaccines. Now, the other thing that I want to add on to what Dr. Dharsee said and connect to what Dr. Mithani has been saying as well is, you know, it's incumbent upon, not incumbent, but it's very preferable that the seniors get vaccinated. But at the same time, it's also incumbent upon, I feel, the younger population to get vaccinated, not simply because they may be more at threat of dying, but also the chain of transmission, who they're passing it down to. And that's, you know, that's very concerning. And Sayyid Rizvi will also probably attest to this, because I think he alluded to this as well, that it is for the protection of others as well. So it is a responsibility that we do take upon ourselves for the general community as well.
Brilliant. Thank you for that. Dr. Mithani, you had...
No, I think Dr. Salehmohamed, very eloquently has made that point. I was going to make the same point. There is one thing when you look at risks and benefits, and that relates to yourself as to what are my risks and benefits. And you may say that, I'm a very young person and my risks are not very high. Although I think, as Dr. Dharsee has said, that we have seen even young people, have significant illness and hospitalizations and ventilators and so on and so forth. But at the same time, you do have a moral and ethical obligation, when it comes to how you become one of the vectors in transmission, And so even if you're a young person and you are potentially you're interacting with seniors. And of course, I talk about my population that I serve, is that, you are going to be interacting with those seniors. Then I think there is an argument, a moral and ethical argument for you to look at, taking that part into account when you're making a decision on risks and benefits. Now, we know, for example, that we don't have as much data on transmission after vaccination. So after vaccination, would you still be able to transmit the virus? The thinking so far is that if you actually get vaccinated, your viral load will probably become very much lower. And so the risk of transmission is probably going to significantly decrease. And number two, I think from a public health perspective, we do want to end up getting to that 70% or 75% of what Dr. Dharsee had mentioned in his presentation of that herd immunity type of a situation, that kind of phrase that has caught on and become so popular, and so at the end of the day, it's all about not just, I think this virus has taught us one thing. It's not just about protecting yourself. It really has aligned with Islamic values, right? And I think Sayyid will be able to talk about that a lot more than I will, but it really aligns with Islamic values in the sense that it's no longer a conversation about just yourself. It's about how you're going to also your religious duty to protect others, becomes a very paramount issue. That's one of the reasons why, initially public health people were saying you have to wear cloth masks, even though we knew cloth masks, do not necessarily protect you, but they would protect others, and so on and so forth. So I think it's a very important thing to not forget that it's not just about you, when it comes to this disease. It's about how you are going to potentially transmit it to a very vulnerable population that will be hospitalized and that will die from this disease. So that's what you have to take into account.
That's a brilliant point, Dr. Mithani. I couldn't agree more. It's a lot more about others we have to think about, and not just ourselves. That's a brilliant point. Thank you for that. The next question, and I'm sorry guys, I know we have gone over, but there's so many questions, and I feel that it'd be an injustice to a lot of people. So another 10-15 minutes, if that's okay with you guys. I'm so sorry. I'm just gonna ask this very quickly. Due to the concerns of the vaccine being new, would the initial dose suffice, meaning give enough immunity from becoming severe if one contracts with just one dose? Yeah.
So there was some immunity that was confirmed with one dose alone. Obviously, you want the maximal protection, which is in the studied, the two studies, one was at 21 days, one was at 28 days. But in order to vaccinate more people, if there's strategies, even if they get one vaccine that has shown that people already started making what we call, the fancy term that I used before, the antibodies, which is the protein that helps protect you, was already started even after the first vaccine was administered. So therefore, even one vaccine, I think, is a start. Obviously, with some mass vaccination campaigns, more and more governments locally, as well as nationally, are leaning towards giving the first dose. And then once the second dose comes in, then to give the second dose after that, instead of saving an initial first dose, initial second dose for revaccination later. So this way we can get to more people, vaccinate more people, at least provide them with some immunity, and then later on get them the second shot after that.
Brilliant, thank you for that. Another question I have is, are there circumstances in which I should not get COVID-19 vaccine? I believe you have touched upon it a little earlier in the last question, Dr. Dharsee, but literally in the next sort of a minute or so, are there any other circumstances you feel that we should not get a COVID-19 vaccine?
So as I talked about, really the only one would be like if you have severe anaphylactic reactions to something, or many different allergies, that would be the one area that I would say that you should hold off for now. As Dr. Mithani was mentioning earlier, the rest of them are what we call relative contraindications, which means that, oh, some people may have a little bit of autoimmune diseases. These are the people that are at high risk for it. So even though some patients may be on some medications which ramp down your immune systems for a reason like autoimmune disorders, for example, patients with lupus are on medications that ramp down their immune system. Patients who have inflammatory bowel disease are on medications that ramp down your immune systems. These patients should still get vaccinated. We don't know the long-term ramifications in terms of like how much immunity they're going to build, but it's still better than being exposed to the coronavirus without any protection at all.
Fair enough.
That would be, I would probably see the main contraindication. As we talked about a little bit about pregnancy, the American College of Obstetricians and Gynecologists do not recommend withholding the vaccine, but I can definitely understand some people's hesitation towards getting it because the data on it is sparse, if anything.
It is.
I don't know if you guys have anything else to add.
Okay. Question for Sayyid now. What is Ayatollah Sistani's opinion with regards to this mRNA vaccines, which were forbidden for use on humans before? So why now?
So there were vaccines which were forbidden before?
Correct.
Mm-hmm.
Were there vaccines that were forbidden before? So this is a question that's come in, and personally, if I'm going to be honest, I don't know this. Were there vaccines that were forbidden before? I know that I can see everybody saying no to that on the panel.
No, as far as the religious opinions are concerned, I don't think there was anything like that.
Brilliant.
At least it has not come to my attention. I don't think so. And as I said, we look at the issue of immediate situation, and you weigh the situation and what is more important to less important. And so there's no issue about it. No.
Great.
I don't think the general public was aware that there was studies going on with messenger RNA vaccinations. This is more of a recent thing and recent concern. So I wouldn't presume there would be. This is, like I said, nobody knew about these research that have been done. Maybe the scientific community, but that's about it.
I believe some of our questions are from the scientific community. But thank you for that. How come this vaccine is 95% effective with such a short research compared to the regular flu shots, for example, which we take every year and are only effective 40 to 50%? I can see Dr. Dharsee actually smirking. Do you want to take it, Dr. Dharsee?
Not so much smirking, but a great passion of mine, flu vaccine. So I'm just excited to answer the question, I should say. So the technology, or the word that I had used before was the antigen, which is that little protein that's on the virus or on the pathogens that's affecting your system. is totally different what we're targeting with the coronaviruses as opposed to the flu virus. So when you say the short term, to answer your question in two parts, I'll deal with the the question mentioned that in such a short term, how did they find such an effective response? That's actually a good thing. Most of the time, when you do see such a big difference between what we call the placebo and the people that got the vaccine, sometimes you have to take that curve out to many months before you see a response. The fact that there was such a response early on and the curve started separating, as I demonstrated in my presentation, is actually a fantastic thing, which tells you that the vaccine is effective. So the time frame itself is actually a good thing, that the fact that in such a short period of time, they were able to find such a robust response per se. As far as I know, they've only taken it out for about 120 days. So therefore, the data is only limited up to that. The second part is about the flu vaccines. About the flu vaccines, so what we usually target with the flu vaccines is, I know people have normally heard of H and N, are the two like letters that are synonymous with flu vaccine, H5N1 or H1N3. Those are different type of proteins that are on the flu virus itself. So normally what we call the yearly flu, what happens is the flu vaccine replicates so much that it actually tends to make a lot of mistakes. And because it makes a lot of mistakes, it tends to mutate a lot, which means from year to year, it changes quite a bit, which is not the case with the coronavirus per se. Now, how do we base flu vaccines? We base it on guesstimating what the previous flu vaccine was like, as well as how the flu was in the southern hemisphere, so we can kind of target the vaccine what it will be in the northern hemisphere. Now, a lot of times, having a flu vaccines that's 60–70% effective is actually fantastic for us. Remember that flu causes some mortality in higher patients, but the degree to the mortality that it causes is nowhere near where COVID was causing, kind of thing like that. So a different animal, but it was a good question in terms of like, well, you can't compare apples to oranges per se. So it's a different kind of vaccine and it's a different kind of disease. I don't know if
fair enough. Fair enough. Thank you for that. I appreciate that. Okay, one more here, and this is very interesting. Currently, general pattern seems to be take it as it comes. What is prudent course of action if COVID-19 becomes an epidemic in 2022? Who wants to take that?
Could you just repeat the question? Sorry.
Sure. It says, what is prudent course of action if COVID-19 becomes an epidemic in 2022? Pandemic in 2022.
So I think we're way past the epidemic area already. We're already at a pandemic already, which means that it's everywhere already. And the degree that it is it's everywhere. Yes, there's a possibility that, if we don't follow what we're doing, that will it be around to 2022? There's a possibility of that. There's no way of knowing 100%. But the whole reason for creating a vaccine is to try and get people immunity of the virus, and therefore by cutting down the transmissibility of the virus, be able to control the virus. Or even if you're not able to control the virus 100%, is to decrease the effects of the virus per se. So if everybody is vaccinated, for example, even if the coronavirus is there and it creates a little bit of a milder disease, I think we would all be happy with that and we will all live with that. So there's definitely a concern that if the virus is not controlled, can it continue to linger? Absolutely, it can. Can the virus mutate? Absolutely, it can. But that's the reason why we're taking all these steps and taking all these measures. And at the same time as we're working on the vaccination part, there's actually drug trials that are going on right now to try and eradicate in terms of helping with the cure and control of the disease as well.
And I think also it's important to understand that, I think probably Dr. Dharsee will be able to comment more about it, but we have also learned a little bit also from the SARS experience that we have had, which was another coronavirus, right? And this actually COVID-19's official name is the SARS-CoV-2, right? So, I mean, it's, you know, we've actually learned from the SARS experience and how we developed, you know, a vaccination strategy and management strategy with respect to SARS, which, you know, you don't hear about anymore. You didn't even hear about it before we start hearing about COVID-19. So I think that there are models in place for us to start looking at how we manage this for the long term so that it's not around and we can get back to some level of normalcy before. So.
Excellent, thank you guys. So I've got only I want to end this at a couple of questions only because I know that we are in about 15, 20 minutes. One of the questions, the two questions I'm going to put together in this one is how long does it take to build immunity with COVID-19 vaccine? And why do we get these fatigue, muscle aches, all sorts of things, all sort of reactions? Dr. Dharsee?
All right, another excellent question. So we know as far as when we start developing immunity from, if you look at the Pfizer trial as well as the Moderna trial, and you look at those two curves when they start separating, you can already see by the time you get to the 7th day after the initial vaccination that the curves already start separating, which means that there's probably some immunity that already starts there. From the earlier trials, which are probably phase 2 trials where they looked at antibody levels, they showed that soon after, a couple days after getting even the first vaccine, you start building the antibody levels that are slowly going up, kind of thing like that. So you probably already have some protection after the initial vaccine, which is a point that we've touched on quite a bit already. As far as how long the immunity is going to last, we know that so far there's data that's published for at least 4 months, 120 days out. Both studies showed that the Pfizer and the Moderna study showed that you had pretty robust immunity going out to at least 4 months out. Now, obviously, I think in the future, we're gonna get some more data from them and then we'll see how much this immunity lasts. I don't know, some people may ask, well, do we need to get a booster next year or the booster in 6 months? I think the jury is still out on that.
We're still in the infancy stages is what you're saying. There is
Yes.
a lot that needs to be done, but okay, brilliant. I have two questions. I want to start off with Sayyid. The question is, we're accepting everything the mainstream narrative is saying. What is our religious duty towards this? I know you have touched upon it a little bit, but just elaborate on it a little bit more for us, please. Thank you.
There is a saying in our ahadith that, you know, every ni'mat comes with a bala element of it. And so this mass means of, you know, information that we have is a very good thing. You know, people can have access to information in a way that 20 years ago, people didn't even imagine about it. But this also creates this problem that you start hearing things from all these alternative theories, conspiracy theories about it. And this is where I think we have to be educated enough on this issue. As we mentioned before, you know, always find out, don't just get the information from wherever you are receiving it, see who is behind it. Are they reliable people or reliable sources or not? You know, I'll tell you, there are even people in this attire that I'm wearing. You might be getting things in social media saying things. They are neither mujtahid to give, you know, qualified to give any fatwa, and they are not qualified, you know, in medical field. They don't even have what we call tabib's certificate, you know, the traditional medicine. Yet they sit down and give, you know, judgments about the whole conspiracy theory going on. And so I think the community has to be educated on this issue, that look at the sources, who is saying that, because this conspiracy, theories have been there for all things. Now it's more, out there in the means of communication that we have. So you get all kinds of things. Be careful about it.
Very well put. Thank you. Thank you, Sayyid. The last question that I have is, and this is a bit of a controversial question, and I'm sure that you guys really like this. What is reliable? Those main media or independent researchers who say that the vaccine has other purposes, especially when the ex-CEO of Pfizer recommends not to take the vaccine. I can see Dr. Dharsee. Everybody has a smile. That's brilliant. Take it.
All right. Not sure about the ex-CEO of it, but what I would probably say is that look at the data yourself. If you're able to look at the data, this is one of the few times in the history where the FDA, because everything is under EUA, everything was kind of working on a global pandemic speed, all of the research was put out there in the open. You can go on the Moderna website, you can read the studies yourself, you can see how many patients were put in one category, how many patients got the placebo, you can review the side effects yourself. And I would just start out with that. If you want to look into that as well, look at the studies themselves. Don't let other people make conclusions for you. As I mentioned in my talk, look for reliable resources. If you feel like the mainstream media or New England Journal of Medicine is biased, then that's your opinion, unfortunately. So there's many journal articles that are out there, and I would just read through them, and make an informed decision. I'm not going to come there and force you to take the shot by any means, but I would probably read and make an informed decision, I would say. I don't know if anybody else wants to comment on that.
Yeah, I think it's actually an interesting question. It's a funny question, and one thing we've learned in this pandemic is how important it has become with respect to how we take information. And sometimes, we need to contextualize it also to our regular religious lives, especially, it's, and I say it respectfully with Sayyid present in this particular webinar, is, it's up to you, right? I mean, whether you want to do ijtihad or you want to do taqleed, right? I mean, if you feel that you have the expertise and, you have gone through the training and you want to do ijtihad and follow your own way, that's good for you. But I think for a lot of people, they are going to rely on what, the medical experts are going to tell them. And right now, I think, the advice is based on, the established kind of research processes that we've seen and that we sort of trust, especially in this area. And I think the decisions from the medical experts are based on that type of information. But I think there are always going to be people who will look for alternate methodologies, who will look for alternate information. And I think that's just the reality of life. It happens, I think, as Sayyid mentioned before, it happens, in, our religious lives. It happens in medical life. It happens in, almost any profession, where, you have people who may have their own opinions. And I think that's to be respected. They have their own opinions. But I think when you start to then, spread those kind of conspiracy theories, widely, and it becomes a level of fear mongering and so on and so forth, where a lot of people are going to suffer and not get vaccinated, it becomes a problem. I have to tell you one thing, Baqer, honestly, and I know Dr. Mustafa and Dr. Dharsee will support this. You really have to work on the front lines. You have to work on the front lines You have to be in the ICUs. You have to understand how frontline healthcare professionals, day in, day out, they risk themselves, donning and doffing and PPE and all of these things, and how you see some of these patients who have been well, how quickly they deteriorate. I mean, my population, I can tell you, the senior population, they get COVID. For the first 5 to 6 days, they actually may have very mild symptoms. And then after 5 days or 6 days, they have what's called the cytokine surge, which is what Dr. Dharsee was talking about before. And they deteriorate in hours. Within a few hours, they go from somebody who has been at home to being on a ventilator in ICU, and within a couple of days dying from it. So, if you're going to spread this information about the vaccine and so on and so forth, and influence some of the people who are going to mostly benefit from it, I think it is important that you're really confident about the information that you're getting, because it is going to have some devastating effect, especially on the population that I look after. And that worries me. It worries me because I've seen old people die from this disease right in front of my eyes. And it's unprecedented what we have seen. It really is. And so I'm fearful and I'm scared. And I'm upset at what's happening to many members of our community. Many members of our community have died from this illness, and some of them we know, some of them that, we have been with, have been very prominent members of our community, and they've died from this illness. And so it's a serious matter. It really is. It's not about, as Sayyid says, you get a one WhatsApp message like the one he mentioned he got yesterday or today or whenever it is. It has some very serious consequences in this age of social media when you then transmit those things really widely. And there is, I think, a responsibility that you have. You really have a responsibility to make sure that you are not perpetuating these things in a way that creates this level of uncertainty in people without appropriate evidence. You just have to be on the front line, honestly, to understand the devastating effect that this virus has had.
It's amazing.
Baqer, I'm just going to echo that sentiment of Dr. Mithani's. First of all, I'm going to say, based on that question and what Dr. Dharsee mentioned, people are entitled to their own opinions. You're entitled to your own opinions, but you're not entitled to your own facts. We've heard that saying quite a bit as well, right? And in the beginning of my presentation, I had talked about these kind of naysayers have been going on for centuries when other treatments or vaccines have been out, right? The last two tactics that I talked about, one was vaccinations are part of a larger conspiracy and using alternative authorities to legitimize their arguments, right? And that's what we're seeing. That's what we're saying. So it's nothing new. It's nothing new. If we had continued this way, we would never have eradicated smallpox. May 8th, 1980, we eradicated smallpox. It took 2 centuries to do that because of these resistant factors. We could have done that way earlier. So that's number one. The other thing is, as Dr. Mithani mentioned, we work in the hospitals. I've worked in the ICU. Dr. Dharsee has seen patients in the ICU. During the peak of this in New York, in Queens, a patient who comes in one day, by that evening, no matter what we tried, we've had to intubate that patient, place him on the ventilator. With most certainty, no matter what I did, and we have all the artificial means at our disposal. We have the ventilator, their kidneys would shut down. We had dialysis machines going on. We had them on blood thinners because these patients developed clots. No matter what we did, these patients died. This just tells you to the tenacity of this virus, to the severity of this disease, where we would see in the ICUs patients die from one organ system failing or another organ system failing. This was as if everything was in one. The lungs failed, the kidneys failed, they had strokes, they had heart problems because it affected the heart muscles as well. It was all in one. This was one of the most terrible instances of ICU catastrophes that we've seen. I've been there when we've had the peak of the flu virus. And we would have, out of our 12 beds in the ICU, maybe 3 or 4, and we thought that was devastating. So here, to give you an example, that was 3 or 4 patients in a 12-bed ICU. In April, at our peak, our entire hospital was 500 COVID patients, 500 COVID patients, of which 100 were in the ICU on ventilators. Just to give you a little perspective, so as to when people try to downplay that this disease is not that severe.
And on top of that, Dr. Salehmohamed, if I can add,
Sure.
this is certainly true in Canada, especially in the public health system that we have. When you have hospitals overwhelmed, because of COVID cases and ICUs that are full of COVID patients, we end up canceling surgeries. We end up, elective surgeries are canceled. People who have, cancer therapy and surgeries related to cancer, those are delayed. It has a ripple effect. Remember, because of COVID, people still have other illnesses. People still have to have surgeries. People still have, need cancer treatment. People still, need diagnostics. People still need a lot. When you overwhelm the healthcare system, because of a pandemic, and essentially most of the cases are COVID, all of these other illnesses, take a back seat, and that has a huge impact on the life of of a population and an individual, because they're not getting timely healthcare because of the fact that we are overwhelming the system. We have to do whatever we can to stop this, really, and to now have potentially a vaccination that will help us in making a big difference, so that we can get to a level where we do not overwhelm the healthcare system. It's very important. When and I was talking to the Islamic Education Board and stuff around the guidance from our respected ulama. We have to contextualize it even to our ulama, that this is serious. This is not just about one person's decision whether to have a vaccine or not. There is a systemic consequence to this pandemic where it overwhelms the healthcare system. We have to be able to look at this in that context.
Can I, Baqer, just add one more point there?
Please.
Yes. I think this issue, especially about, alternative theories out there, I think the community has to also be careful that even forwarding all these kind of messages, there are religious implications on that.
Yeah.
Because the Quran is very clear about it. Let me just first of all, talk about this WhatsApp message that I got. It starts with saying that the vaccine is not safe, says the UK government. And then they list the item. Number 1, the vaccine is not safe for pregnant women. And when I check with the actual website, it doesn't really say that. It just says that, if you're pregnant, consult your doctor about it before you get the vaccination. Or for example, they talk about if you are planning to become pregnant, it is not safe for you. It is not known if the vaccine will cause infertility. Well, there's no positive statement about it, but and so basically the information is taken and then put in a very different context, and this is misleading and misinformation. Quran is very clear, and I'll end with this ayat from Surah number 17, ayat 36. But Allah subhanahu wa ta'ala says, لا تقف ما ليس لك به علم. Do not speak about things that you don't know. If you don't have the knowledge and the expertise, don't talk about it. Don't circulate this even further to others. Why? إن السمع والبصر والفؤاد كل أولئك كان عنه مسؤولا. Because remember, your ears, your eyes, and even your mind, what you think, everything, all these organs that Allah has given to you, the faculties, they are mas'ul. They will be accountable in the eyes of Allah on the day of Qiyamah. So we have to be careful about it. You can be a mujtahid, unqualified. Keep your own opinion to yourself. Don't, circulate it out there, because then when you are doing that, you are becoming responsible for whatever action the other fellow will take. And then that is a very serious issue. May Allah subhanahu wa ta'ala protect everyone from that.
I mean, thank you for that. I just want to reiterate something over here. Once again, this webinar is intended to provide you with both medical and religious perspectives on COVID-19 vaccine. The information you hear today is not a substitute for any professional medical advice, diagnosis, or treatment. We strongly encourage you to consult your doctor or other medical professional regarding the vaccine, COVID-19, or any other medical questions you may have. At this stage, I would like to thank our panelists here for their insight and their time. May Allah subhanahu wa ta'ala reward you and your families in abundance for your efforts. I'd also like to thank our viewers who have tuned in from all parts of the world. We've had some brilliant questions from them, so thank you for that. Thank you for joining us and hope you have found this beneficial. In the end, I'd like Sayyid to do a dua for us for the reappearance of our Imam.
اللهم صل على محمد وآل محمد بسم الله الرحمن الرحيم. اللهم ارزقنا توفيق الطاعة وبعد المعصية وصدق النية وعرفان الحرمة وكرمنا بالهدى على صراط محمد وآل محمد. Allah, keep the entire humanity away from this negative impact of coronavirus. Allah subhanahu wa ta'ala, give us the wisdom to understand what is right and what is wrong so that we may fulfill our duty in the right way. And Allah hasten the appearance of the Imam of the time. أجل الله تعالى فرج الشريف. ربنا آتنا في الدنيا حسنة وفي الآخرة حسنة وقنا عذاب النار برحمتك يا أرحم الراحمين.
Thank you very much once again, everyone.